Hi guys, welcome back to the Veterinary Technician Online CE. We are working our way through 6.1, which is common diseases of small animals, and we are going to talk about diseases of the reproductive system. So we're going to start with the female. So vaginitis. So it's very common in prepubertal bitches. Common signs is vaginal discharge. We're going to want to treat with antibiotics, and it usually resolves after the first heat. But adult vaginitis may be due to anatomical abnormalities, bacterial infections, trauma, or maybe even chemical irritation. This is what the vaginitis is going to look like. You can imagine how painful that is. So you're going to see extreme swelling, redness, and they're most likely going to be excessively licking that area. Pyometra. This is very commonly seen. Everybody should be familiar with this by now. It's caused by an increase in progesterone after they ovulate and they weren't bred. The progesterone increases and it can cause a pyometra. So it's actually a bacterial infection in the uterus. It's common in middle-aged animals or older and within 60 days of their last estrus cycle. So they went through their estrus cycle, probably 2 months afterwards, they'll come up with a pyometra. Clinical signs, there may be some discharge, vulvular discharge, except for if it's a closed pyo. So remember, the reproductive system from the outside in of a female goes the vulva, the vagina, the cervix, which is a sphincter, and it closes things from going up further or coming down out. Okay, so it goes vulva, vagina, cervix, uterus. Okay, so if it's an open pyometra, that means the cervix is opening up a little bit to let, because the pus is going to be filling up in the uterus. And so if it's opened up a little bit, the pus will be able to dribble out through the cervix, and then you'll see the discharge. If it's a closed pyometra, that means the cervix is doing its job and it's pinching off really tight and not allowing anything to leave the uterus. So obviously that's worse, because you're going to have, it's not going to be able to come out at all. It's just going to build and build and build. You may see some abdominal enlargement. They're going to be lethargic and vomiting, and PUPD. So we're going to take an x-ray to see the enlarged uterus. If we're worried about pregnancy, you can rule that out by doing an ultrasound. We're going to want to do some blood work as well to see if this problem and infection has gone systemic, and maybe do a vaginal cytology as well. How do we treat it? We spay them. If not, there's 26 to 40% chances of reoccurrence within a year. So very high chances that this is just going to keep happening again. So most of the time we just go ahead and spay. Spaying your female will prevent this disease, and that this is one of the reasons why we really encourage spaying young pups and kittens. Because we don't want this to happen. So spaying them will obviously eliminate that, because we're removing the reproductive system altogether. And early aggressive treatment is very important, because they can become very toxic. So this is an x-ray here. To your left, it's going to be a normal x-ray. So what we're looking at here, the animal's in lateral recumbency. This is the pelvis here. This is the bladder. Quite a large bladder going on in here. This is feces in the descending colon right here. This circle right here and this circle right here are 2 kidneys. But everything looks normal. You actually can't even see the reproductive system typically. But this is a pyo x-ray, and this big bubbled out thing that we see right here, that's actually the uterus that we're seeing. So that's showing us the pyometra. This is what a pyometra looks like when we surgically remove the uterus. To your left is what a normal uterus is going to look like. And to your right, this is a pyometra. So the uterus and the uterine horns are literally filled with pus. Pregnancy disorders. So 65 days is a normal gestation for a cat and dog. An easy way to remember that is humans are pregnant for 9 months. Cats and dogs are pregnant for 9 weeks, roughly, give or take. At 20 days, you can do an ultrasound to check the status of the fetus. You can see the heartbeats at that point. At 25 days, you can actually feel the fetuses, and you have to wait until about 45 days to do an x-ray to see the skeletons, because the calcification of the bone doesn't happen typically until the 3rd trimester. So you'll see skeletal mineralization, and you can take an x-ray and see that. If fetal death happens early, in that 9 weeks, the body will actually reabsorb the fetuses, so you don't even have to remove them. This here is an x-ray of a pregnant dog, and there are 3 babies in this x-ray. So typically, instead of counting the spines or the ribs, which people tend to always want to do, we actually count the skulls. So there's 3 visible skulls here, so this mother is pregnant with 3 babies. And this is obviously late in the pregnancy because there has been mineralization of the bones, which is the only way that you can see these fetuses in an x-ray. So one type of pregnancy disorder that we can see is dystocia, which just means difficulty giving birth. And there can be 3 different reasons. Typically, there's something wrong with the fetus. Either he's malpositioned or he's too big. Something wrong with the mother. So she could have a narrowed birth canal, so she's too small. Or maybe her uterus has just completely stopped contracting and it's not pushing the fetus out. Or the 3rd option is both, right? If you have a small mother, a big fetus, that's going to be bad. The mother's not going to be able to give birth to that baby. So clinical signs of dystocia is she's been in labor for longer than 4 hours without passing anything. Green vaginal discharge, and or 1 hour has passed since the last birth. So you should have no more than 1 hour in between fetuses. How do we diagnose? We can palpate, we can x-ray, we can ultrasound, but typically it's just the clinical signs. And how do we treat it? You could do manual manipulation. So you can actually try to palpate, maybe put a finger and rotate, or try to help out the baby and reposition it. We could also give oxytocin, which is a synthetic hormone that will increase uterine contractions. And if that fails, then it's a C-section. So what we should tell the client is owners should prepare a whelping box that the animal will like, so with some nice comfy blankets and a nice quiet space where they feel comfortable. Nutrition is so ridiculously important with pregnant mothers, and anytime you have a friend or a client or anyone that says, I have a pregnant dog, you should be thinking, please tell me the dog is on a puppy food while pregnant and also while lactating. They need to be on a puppy food because they need an increased calorie and fat. Okay, so that should be a recommendation automatically made with a pregnant kitten or puppy, and they go on puppy food or kitten food throughout their whole pregnancy and during lactation. Okay, during the birth process, owners should keep an eye, but don't hover and don't disrupt the mother. Keep the pets and other children away. You have to make sure it's cool and calm so that they can do their labor, and because we don't want to create a dystocia, right? So we have to keep them nice and calm. An interesting fact, their rectal temperature will actually decrease about 1 degree 24 hours before they give birth. So a lot of breeders will monitor their temperatures around the time of the birth, and they'll know that if that temperature does drop, they'll have a baby within 24 hours. This is a really cool video of a C-section. I suggest you watch it. Okay. Another pregnancy disorder that we can have is inappropriate maternal behaviors. So typically a good mother is going to be nursing her young, should lie very quietly as the youngs do this. They will retrieve their babies, but be very gentle. They're going to groom their babies, and a very important part of maintaining the health of those puppies is the grooming, because this stimulates the cardiovascular system and respiratory system right after they're born. And it also stimulates elimination. Puppies and kittens cannot defecate or urinate on their own. The only way that they can defecate and urinate on their own is by the mother licking the area, the perianal area, and that's going to stimulate them to urinate and defecate. And the mother actually eats it, which is gross, but That's how the puppies and kittens urinate and defecate. And then after a few weeks, they'll start doing that on their own. If you have an orphaned kitten or puppy that you're hand raising, you have to like take a little dish rag and gently massage the area, the penis, the vulva, and the anus, to stimulate urination and defecation, or else they're just not going to do it, and then they'll die, right? So, and the mother's going to be quite protective of her young, and that is normal behavior. Inappropriate or abnormal behavior, the mother's going to be really restless, and she's not going to want to stay with her babies. The babies are going to be constantly crying, and the mother may actually attack or kill or eat her young. Very inappropriate behavior. The babies need to be removed from the mother. How do we treat this? Remove them. Or you may even choose to tranquilize the mother so that they can continue nursing. This mother should not be rebred. She doesn't have that maternal instinct that you would want in a mother, and don't leave the babies alone with the mom. Mammary tumors. This is the most common tumor in female dogs. It represents about 50% of tumors that females get are mammary tumors. It's the third most common in feline females. Often happens in older animals. Some dog stats, if they're spayed before their heat, there's 0.5% chances of them getting mammary tumors. If they're spayed after their first heat, there's 8% chances. Or if they're spayed after 2 or more heats, there's 26% chances of them getting a mammary tumor. Half of the canine mammary tumors are benign, which is good news, but the bad news is that half of these tumors are going to be malignant. Now, there is controversy and debate on whether spaying your dog actually decreases the chances of mammary tumors, but for the sake of this PowerPoint, we are going to go with these stats. For cats, there's no difference whether spayed or not. 10 to 20% of feline mammary tumors are benign, which means that more likely it's going to be malignant. Tumors smaller than 2 centimeters, their survival time is up to 3 years, but if it's bigger, then obviously it's going to be a decreased survival time. They may have malignant and benign tumors at the same time. So we have to make sure that if there's several tumors, we have to do biopsies or fine needle aspirates of every single one of them to make sure that we know which ones are benign and malignant. Clinical signs, you're going to see the tumors on the mammary tissue. And how do we treat it? We do surgical removal and or chemotherapy. So we would take those masses and send them off for histology to see whether they're malignant or benign. So 50 to 60% of canine tumors have estrogen receptors, so OVH may help decrease the chances. But again, this is recently in veterinary medicine been a little controversial on whether that's true or not. This is what mammary tumors look like, very obvious. Now, moving on to diseases of the male reproductive system. Prostate disease is more common in dogs than it is in cats. It's the only accessory sex gland that dogs have. Remember, cats have also bulbourethral glands. The accessory sex glands are the glands that aid in semen travel, sperm travel. Okay, so sperm with the liquid from these accessory sex gland make up semen. Okay, so the prostate gland again produces fluid to help the sperm during ejaculation. And this prostate actually increases in size as the dog matures. Unless they're neutered, then it actually shrinks. So neuter your dogs. Benign prostatic hyperplasia, so the prostate increases in size, but it's not a cancerous. Clinical signs, a lot of the time they're asymptomatic, but they may have some tenesmus, which is straining to defecate, or it looks like they're straining to defecate. Prostate enlargement, but not painful upon palpation. How do we treat it? We neuter them, and it'll decrease 70% in size a week after, which is quite impressive. And we may even treat with some medication. So it's very important to talk to owners about neutering their dogs early in age so that this just doesn't happen. Prostatitis. So predisposed to bacterial infections due to urethra. So the urethra lies right underneath this prostate gland. So a lot of the time E. coli can cause prostatitis. Usually affects sexually mature dogs. Clinical signs, they could be asymptomatic: anorexia, fever, lethargy, stiff gait, and abdominal pain. How do we diagnose this? The UA will show a bacterial infection. We can do a physical exam and culture the urine as well. And we would use antibiotics and also neuter them to help out decrease the size of that prostate. Cancer of the prostate, neoplasm. It's uncommon in dogs, but it is seen in cats. It can be found in intact or neutered males, and all of them are malignant. So treatment is unrewarding and the prognosis is bad for these guys. Priapism and paraphimosis. I have seen this a few times and it's very, very sad. When we're talking about priapism, it's a constant erection. So it actually ends up being quite embarrassing for the owner, but it's very painful for the dog. So us as veterinary professionals, we can't get embarrassed or laugh or anything like that. We have to really understand that this is very painful for the dog and we have to correct it. So what happens with the constant erection, there is an impairment of the vein drainage. So delaying the treatment and not fixing it can actually cause penile necrosis because of the lack of circulation. Paraphimosis is just basically, it's not necessarily an erection, but they're unable to retract their penis. So they can take the penis and retract it back into the sheath, right? And that's normally what's done. But in this case, they can't. It may be due to self-mutilation. Maybe there's a hair wrapped around the penis or the prepuce. Fractured os penis. Maybe, unfortunately, in abuse cases, a rubber band or a string was put around there. It's very painful. The tissue is going to dry out and may become necrotic. We have to treat by reducing the swelling. Okay, so we reduce the swelling of the penis. We use a whole bunch of lube, and then we push the penis back into the prepuce. And then we'll put them on anti-inflammatories for a few days. It's very, very painful. So these here are examples. This top right one is a priapism, so a constant erection, and they're actually draining out some of the blood so that hopefully the erection will subside. I would say that the dog over to the left is a paraphimosis where the penis is just stuck out, and the same as the other guy. I do believe this is a chinchilla on the bottom right. Either way, very, very painful. We have to make sure that we put a whole bunch of lube on it and try to help decrease the swelling and push that back in. It's very, very painful.